I want to model the behavior that we wish to see, which is we want programs to come back and expand their ask for get additional sources of funding, but also come back to us and take our feedback. And so I think we want to model the behavior that we want to see. So that's one reason that I would like to fund this one at that lowered amount of $210,000. So I wanted to state that comment and open it up for discussion or for anybody to make a motion.
I'll move to approve the CCMHB funding of $210,000 for Wind Recovery, Wind Resilience Resource Center, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I'll second.
Thank you very much. Joachim motions, Brandel seconds. Any final discussion?
I would just like to say I'm really pleased that we're able to fund this program this year. Obviously, people coming out of incarceration need housing, and this is a very high need population. Obviously, we fund first followers, and this is just another demographic and very important group. I really am proud with how Wind Recovery has, been resilient and has persisted in, applying for funding this year, and just really pleased that things are turning out the way they are.
Thank you very much. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Elaine Palencia?
Yes.
Al Patterson?
Yes.
Jane Sprandel?
Yes.
Jen Straub?
Yes.
John Paul Joachim?
Yes.
Jen Aras?
Yes.
Molly McClay?
Yes. And with that, the motion passes. Partial funding is approved. So it looks like we were at the end, but we're not quite yet. So there was one request that we never reviewed as a board because we had determined that any programs that did not turn in their required audit would not be reviewed until the time at which their audit is turned in. And unfortunately, this last application did not ever turn that audit in, so we could never review them. And at this point, we are out of funds to give, aside from the very small fund balance that we will build up. So we will go ahead and vote on this one, but it's a little bit different because we never did review it. So this one application is for Task Inc., Outreach and Recovery Support Services, a new program requesting $90,429. So would you share about this one, even though I kind of already made it obvious?
Well, first of all, thank you to Member Aras for saving me just now. Yay, we're back, and I can relax. So I checked my email, and because this is the very last minute, and there is still no audit from them. So I think that we will stick by the suggestion that you deny funding for this one. It's not affordable. It's a new program by a new agency that we have no experience with, and there's not an audit to support it. So, but I actually really like Task, so a little bit sad about this.
Thank you very much, Lennon. Yeah, I think this one is hard because this does have, it is an agency that has a good reputation, and so like a large agency. But I know we've gotten into issues with really, really, really late audits before, and I would like to see, if they come back for funding, like this issue to be remedied before we offer funding in the future. Is there any other discussion, or would anyone like to make a motion?
I'll move to deny CCMHB funding of $90,429 for Task Inc., Outreach and Recovery Support Services.
I will second. So Joachim motions, McClay seconds. Any final discussion? Seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson?
Yes.
Jane Sprandel?
Yes.
Jen Straub?
Yes.
John Paul Joachim?
Yes.
Jen Aras?
Yes.
Elaine Palencia?
Yes.
Molly McClay?
Yes. And with that, the motion passes, funding is denied. And with that, we have concluded our allocations. So I'd like to give a round of applause to everyone who is involved with all of this, and a special shout out to Stephanie Howard Gallo for a marathon of roll calls. So I'll give a little clap. And I thought we were going to have a nice little break and have Dr. Dariotis talk to us about the evaluation capacity building project, while we just take a little breather from all the stuff we just did. But that is not happening tonight. And so the next item of the agenda is board officer elections. So we will go ahead and move on to, I did promise one other thing, which is that I tallied up the amount that we were giving. And I sure hope that this is right. But so we awarded $2,982,192 tonight. And then there is an additional set of funds that is sort of from the 2-year contracts that are continuing from last year. And that amount is $2,959,640 tonight. And so I added them up on my calculator, and I hope it is correct. But I'm going to say, the 2-year one it came from the spreadsheet. 2,959,640. Is that right?
Oh, okay. No, I don't know. That doesn't, I guess I might have made a mistake in the memo. But okay.
I was looking at the spreadsheet instead of the memo. But now that I've looked at it, I'm not sure where that other number came from. I think it was from the prior 2 years. Well, maybe we
I
shouldn't.
think the really good news is that we match on what you just spent.
Okay, yes.
That's really good.
It appears that we have in total will be allocating about $5.9 million. But maybe Lynn and I need to compare our math. So strike the second number from the record. Well, you know what I mean. So maybe if anybody wants to do math through looking at the memo, and wants to make it during board announcements later, that would be cool. I will probably not be able to do that math while conducting the rest of this meeting. So with that, we will move on to new business, and we will move on to board officer elections. So how this is going to work is first, just the opportunity for anybody to ask questions about the election process or about the positions. They're also in the packet on pages 51 through 54. The board's bylaws are included for information, clarifying that election of officers is to take place during a meeting held after the appointment of members to terms beginning January 1st. And prior to July 1st, so we're within that window. Terms are for 1 year beginning July 1st. So I will first, give the opportunity for discussion. Then I will open nominations. First, I will open nominations for president. Then I will open nominations for vice president secretary. And then once we have heard, nominations, I will close the nominations. And then there is a suggested motion in the packet that we can use, subbing in the names for the people who we want to vote on. I will also say if there are no nominations, the current officers will continue in their role until such time that someone emerges as a candidate. Let's just hope that doesn't happen. So is there any discussion or questions about the positions themselves? All right, seeing none, I would first like to open nominations for the role of president.
I would like to nominate Jane Sprandel for president. She's been on the board for many years since I started on December 2019, right before the pandemic. I started. Yeah, it's been me, Kyle, Elaine. I feel like for the longest time, us four. And just watching everybody grow, knowing that we're all part of a team, Jane being, open and growing over the years, I think she would do well as a president.
Thank you very much. Can I have a second?
I second.
Thank you very much. Jane, do you accept the nomination?
I will.
Thank you very much. Are there any other nominations for president? All right, seeing none, I will go ahead and close nominations for president. And now I will open nominations for vice president secretary.
I will go ahead and nominate Molly for vice president secretary. As much as I want you to keep being president and a phenomenal job that you have done, I think it'd be great for you to be VP for a little bit.
Thank you very much. May I have a second?
I second that motion.
Thank you very much. Self, do you accept the nomination? I do. I think it would be a little bit of a rocky transition for me to go from being president to like having no leadership role. I think it's going to be a little bit of a rough road getting off the president train. So I'm happy to serve in this capacity and support our president. Are there any other nominations for vice president? One thing I wanted to say is I was talking to Lynn and I heard that the newly voted Sangamon County Mental Health Board that just got approved via referendum in March has had 103 applications for their 7-member board. So I'm like, come on, Champaign, we got to get some more people applying. And it's very interesting. I'm like, I don't know how they're going to pick that, but it was interesting to kind of make that comparison. So, last call for nominations. Unless I already closed, but I don't think I did. All right, I will go ahead and close nominations. If anybody wants to make the motion in the packet to for the election, you can. Otherwise, I can do it since I wrote it out.
I move to elect Jane Sprandel as president and Molly McClay as vice president secretary to the Champaign County Mental Health Board for the terms beginning July 1st, 2026 and ending June 30th, 2027.
I second.
Thank you very much. Straub motions, Ara's seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. All those in favor say aye. All those opposed, same sign. The ayes have it. We have elected Jane Sprandel as president and Molly McClay as vice president secretary beginning July 1st. Congratulations, everyone. And now we don't have to vote on anything else, which is nice. All right, we will next move on to reports. The first is staff reports. These are on pages 55 through 66 of the packet. Reports are from Kim Bowdry, Leon Bryson, Stephanie Howard Gallo, and Chandra Somerville, and these are included in the packet for information only. Lynn, is there anything you want to say about the reports, or is there any discussion?
No, I mean, the staff reports are like, I know what we're working on. So there's like, but there's still sometimes stuff I didn't know people did. It's very interesting. And we really did, I think all of us spent a lot of time learning more about accessible documents and kind of developing a commitment to it. because accessibility is important. It's not required for another year, but we're still interested in it, so yay. But there was a lot of good information here, so enjoy them.
I just want to say I always find these illustrative and impressive, and thank you for all the work you do.
Yes, I concur. I did want to know several reports mentioned something going on with the Human Services Council of someone resigning. Maybe what and how like nobody is like taking up the mantle of facilitating that group. I was just curious about what happened and what will happen. If the answer is we don't know, then that's understandable. But I did want to note it. Any comments from staff on this one?
The times they are changing. To my eye, it happened kind of suddenly, but I don't think that's true. I think they were looking for someone to replace themselves in the chair role, and no one was stepping forward, so they stopped.
I
Oh,
can answer
thank you,
if
Sean.
yeah, just letting you know that she resigned one day when she was on vacation, and so she has agreed to keep the group open. So the group is still open as far as like announcements, updates, community information. So there's still access to the information. We're just not meeting, which for some people that is fine because a lot of times things can just be said in an email. And so that's what is happening.
Thank you very much for that information. Are there any other questions or discussion? All right, seeing none, we can next move on to the community behavioral health needs assessment activities. These are on pages 67 through 69 of the packet. Minutes of the April work group meeting are included for information only. So Lynn, would you like to share anything from this?
I missed that meeting, but they sent me the minutes, and so I put them in here, and I learned from just looking at them. And there was a meeting today, so you'll have minutes next time from this meeting. And I was at that one. So yeah, it's good work. I like their objectives. I think that it's, they're on the same track as we are. They do like to have measurable objectives, such as reduced ER visits. And I'm a little bit concerned about some of the ways you could reduce ER visits might not be good reason, like just not taking people to the ER when they need to go there is a way to reduce the visits. But I think we all in that meeting know what we're talking about, and hopefully there'll be some care to like only count the data which are comparable. And they've developed a social isolation survey, which they talk about in here, but they haven't launched it yet. We talked about it again today, so that's all.
Thank you very much. Is there any discussion from the board on this?
I'm going to add, I was also on that call today, and a gentleman from OSF explained their up and coming programs, designating different floors for different ages there at OSF. So that'll be in the meeting notes, but it was very interesting, and it was very interesting to hear other agencies talk about stuff. They had talked about Promise, they talked about Rosecrans. So it was nice. There was a gentleman there from Carl, and it was very nice how they all just kind of interweaved all the resources in our community. So
we learned July 1 is the open for the geriatric psych unit, and then September 1 for youth, right?
Yeah, so September, that will be ages 18 to, I believe, 26. And then the fifth floor will still be, I think, like 26 to 55. Then they've got the geriatric floor. So yeah, that's interesting. They will not offer any care for 18 and below, but Pavilion is able to provide that care. I did ask the question about referrals to, this facility, and they would come from all over the state of Illinois, which, of course, in typical Jane fashion, I shared how, wow, we have such a need in Champaign. I hope our community can use this. So, yeah.
Thank you both very much. Is there any other discussion? All right, seeing none, we can next move to Disability Resource Expo and AIR updates. It says oral updates will be provided, time permitting, and the websites for these two programs are also listed here, but we may be in the time permitting, no oral updates this
The
time.
websites are also both under construction as she works to meet some of the ADA standards that we were not meeting before. So I don't even know if you can see them now. But we've been getting plaques for people, the coordinators, the last coordinators, the Dylan and Allison Boot. We had some really beautiful plaques made for them. Kim Bowdry sent them out today with a really nice letter, and we're working on a recognition of Barb Bresner. So that's the update.
All right, thank you very much. Any discussion from the board? All right, seeing none, we can next move to program year 2026 third quarter service activity reports. These are on pages 71 through 130 of the packet. For information only, are reports on third quarter service activity of programs currently funded by the CCMHB. Lynn or Leon, would you like to share about this?
The agencies continue to show out. Reports are turned in on time. I think we may have had 3 requested extensions, but we received those reports within the week or so. So fantastic job. Keep up the great work.
Thank you very much. I also wanted to concur. I didn't get to read them as in depth as I would have wanted in preparation for today, given everything else that we were working on. But I noticed a lot of programs are really meeting their targets and hitting them well, I mean, some of them have already exceeded what their targets were, and we're not even to the end of the year. There were a few where I was a little concerned, and I'm not going to talk about them now, but for the most part, everybody is doing incredibly well, which is a definite further bolstering of our decision to keep funding the programs that we're already funding. Are there any other comments from the board on these reports? All right, seeing none, we will next move on to public participation agency input. So again, as always, members of the public are welcome to share with the Champaign County Mental Health Board their perspectives. As I've said, we cannot respond directly to public input, but we may use it to inform future actions as we have tonight. So we do welcome this input. There's nobody remaining in person who can come up and give public input, but if anybody online would like to, or if any magical person does appear in the room, you can approach the podium, fill out a comment card, or if you're on Zoom, you can raise your hand or designate yourself in the chat as wanting to speak. I may limit individual time to 5 minutes and total time to 20 minutes. So is there anybody who would like to make public input? For somebody who's wanting to make public input?
Carrie Hacker.
All right,
Welcome.
Carrie, please welcome your comments. Please share.
I just want to say thank you to everybody that serves on this board. It's not easy, the decisions that you have to make at this time of year. And I'm just very grateful to each and every one of you that serves this committee and this need in the community.
Thank you so much for your comment. Is there anybody else online or in person who would like to make public comment? Someone stepped out, so I'm watching if there's anybody raising their hand. I guess I'll just peek to see if there's anybody that put something in the chat. So hold on a sec. All right. No one else has designated themselves as wanting to speak, so we can close public input. Next, we will move to board-to-board reports. As always, members of our board can serve as liaisons to community and agency boards. There's kind of a list of options for that on pages 131 to 132 of the packet. And if you are interested in being involved with that, you can talk to Stephanie. Is there anyone who would like to share a board-to-board report?
Well, I continue to go to Community Coalition every month, and it's different every month, and it's, I think, the most interesting meeting in town. So if you have time to go sometime and just see what you can pick up about agencies that we know of and agencies we've never heard of, and how they interact there and find collaborative moments. So.
Thank you so much. Is there anyone else who would like to make a board-to-board report? All right, seeing none, we can next move to county board input. Den, do you have any input to share with us?
Oh my gosh, can y'all help the county board with the being compliant on their PDFs and stuff? Oh my gosh. I've had to lend people magnifying glasses. We need help. We need help. So.
Thank you for that. That is, oh yeah, Lynn, go ahead.
I think we love the county staff who are doing that work, like love them. So I don't know that we have the capacity to help, but they're really trying. So maybe we'll have like a support circle or something.
I'm sure they would love that.
Yes, that seems like a good plan. And we definitely, I know our staff cannot take on more. So I also want to protect them. But everyone deserves support at this time. All right, next we can move to Champaign County Developmental Disabilities Board input, of which we heard a little bit earlier. But Lynn, would you like to share anything else? Or Kim?
Yeah, you did. You heard the main stuff. I do have one thing that I announced to them. It's not really, but I'm just so excited about it. I got an email during their meeting that I'm invited to a small conversation with U.S. senators to talk about improving long-term care. So I'll probably be too nervous to say anything good, but I'm so happy to be invited. So.
Well, that is super, super cool. Congratulations. You were a great representative to have that conversation. All right, we will next move on to board announcements and input. I will go ahead and start because Lynn gave me the corrected totals. So now we're looking at, so what we allocated tonight is $2,982,192. And then we have, on the 2-year contract side, it's $3,329,421. And so a total amount of awards, and this is much more in line with what I thought the number would be, $6,311,613 that are awarded for PY 2027, which is pretty awesome. And if we ever need a reminder of like why we do this, being able to give out that kind of money that our community has decided to set aside for mental health and substance use services is amazing. Is there any other announcements before we close?
I'll make it snappy. The first one, like we have said it so many times, I really appreciate, and I know all of you do too, all the hard work that Lynn and all the staff have done. It's been tireless. I know we've all been, emailing them, asking questions. They've been very attentive at meetings, helping us. And so obviously without our amazing staff, we would not have been able to award over $6.3 million. So that's my first huge thank you. And I will say it every day because I mean it every day. And then I'd also like to thank Molly for being our president the last 2 years. She's left some big shoes to fill for me. She did have, we spoke a little about how it was very helpful when she took over after John, and John was her vice president to help kind of guide her. And so she's like, if it's okay, I would do that. And I'm like, perfect. And in a nutshell, I believe that even the president or the chair and the co-chair, we just happen to be people who run the meeting, that each of our votes are equal. And, I want everyone to speak up, text me, call me as we move forward. And likewise, Molly is a great person, especially when it comes to numbers and stuff, like give her the number stuff. But, so thank you for entrusting me to be your next chair.
Thank you very much. Are there any other board announcements or input? All right. Seeing none, our last item is to adjourn. So because we have canceled the June meeting, our next meeting will be July 22nd, 2026. Back here in the Shields Carter room of the Bennett Administrative Center in Urbana, where our new officers will be have been installed. I guess we've sort of installed them now, but they will officially take part in that one. So with that, I hereby adjourn this meeting. I hope you all have a great night.